Hi everybody, I'm Andrew and I'm going to be talking about educational animal use and alternatives. My story begins here at West Australia's Murdoch University, which is an AVMA accredited veterinary school, one of the leading veterinary schools in the Southern Hemisphere. And where I went to veterinary school, it seems like a million years ago, probably when dinosaurs were roaming the earth, more or less. Um, As you can see, it's a very beautiful campus. That's the center of campus. It's called Bush Court. We had bunny rabbits that would roam around the lawns in the morning, kangaroos that would hop around the back paddocks by the veterinary schools, and so on. When I entered veterinary school, of course, I wanted to become a healer of animals. I realized that parts of the veterinary degree might require harmful animal use, but I was unaware of what the details of that would be. And I had the vague idea that humane teaching methods were probably available as well, but again, I wasn't really aware of what they might be. And thus unprepared, I entered first year of the veterinary course back in 1997. In the introductory biology units, we dissected rats, slugs, worms, various body parts from abattoirs. And for reasons that were never made clear, there seemed to be a strange obsession with requiring us to dissect lampreys. Most of these body parts appeared on wax dissecting trays, wrapped up in plastic, resembling more pieces of meat from a supermarket rather than living, breathing animals. And this helped me to dissociate from the reality that animals were being killed wholesale for my education. This sort of fog of dissociation and it really helped me not to think seriously about the issue. And this strategy of not thinking very much worked very well for me up until the end of first year when something different happened. There was an introductory biology unit we where rats were being killed by a demonstrator just prior to the commencement of the laboratory class, and they were very much alive. They were living, breathing, running around their cages, and then they were killed so that we could dissect out the intestinal tracts with cells that were still alive and record the uptake of glucose by living intestinal cells when dropped into various solutions. To demonstrate some scientific principles that have been established for decades and could certainly have been learnt in other ways. Uh, the fact that these animals were still living and breathing and running around successfully broke through my fog of denial about this issue. I decided that there was no way that I was going to be involved in the killing of animals to teach something that could easily be learnt in other ways. And I went to the demonstrators uh, and voiced my objection to participating and requested a humane teaching method. On this occasion, unfortunately, I was ill prepared. I hadn't studied what the alternatives might be, where they were used elsewhere, what the educational evidence might be, and I only voiced my request on the morning of the laboratory class. My request was denied, with the result that I ended up boycotting the lab class. This then cost me a grade in that particular unit, which really was well worth it, I thought, because this stirred up enormous controversy with some students and instructors supporting me, some opposed. All of this great controversy, I'm told, had nothing to do with the fact that the lab was then cancelled the following year, saving the lives of around about 40 rats per year, which I thought was well worth losing a grade over and a fantastic outcome. At one stage, I was hauled into the offices of the two professors in charge of the course, and they gave me dire warnings that what I had seen so far was only the tip of the iceberg compared to what I would have to do to animals later in the veterinary course, and that perhaps I should rethink my choice of career. This wasn't successful in making me drop out of the veterinary course. Instead, it motivated me to go away and seriously learn about alternatives, courses elsewhere in which they were being successfully used, and the educational evidence about the teaching of efficacy of these sorts of methods. So that next time I was being cross-examined by professors like that, I would have appropriate evidence and reasoning available. Um, I'm going to show you now some pictures of what happened next when I entered second year. And there's all sorts of horrible pictures of dissected animals and so on coming up. So if you don't want to see these, probably look away now. In second year, we entered the anatomy class, and we were split into student groups of about 3 or 4 students. We were each given a greyhound from the blood donor colony within the veterinary school. And these were greyhounds that had been donated for use in the blood donor colony and then for teaching purposes after they were no longer able to race fast enough to be profitable within the greyhound racing industry. After a couple of years in the blood donor colony, they were typically humanely killed, and then we would be given one of these cadavers. Each week we had a different dissection project. One week might be a forelimb, and then a hind limb, and then the chest cavity, then the abdominal cavity, and so on. And in between times, the cadavers remained in the anatomy core room there. We dissected various other animals that were typically purpose-killed animals in the anatomy laboratories. In second year physiology within the veterinary course, there wasn't dissection going on. There was demonstration experiments. This was vivisection, the cutting into living creatures. Again, not to learn anything new, but to demonstrate various physiological concepts that typically had been well established for many years or decades and could presumably have been taught in other ways. Typically, we would conduct invasive experiments on toads, or most commonly sheep, actually. And we would do things like student groups would anesthetize one of these animals, trying to follow not always clear instructions in laboratory guides with minimal supervision by overworked demonstrators within our large student classes. After being anesthetized, students would do things like occlude airways or force their sheep to breathe various gases. They would cut in and they would ligate arteries. They would transect nerves, such as nerves leading to the heart, vagal nerve, in order to see what this would do to the heart rate and see what the effects on the animals might be. Any surviving animals by the end of these laboratories, and not all had survived to this stage, were then killed by anesthetic overdose by these students. One other student and I refused to participate in all of this mass killing, and with the result that I don't have any photos of these laboratory classes. And then in third year of the 5-year veterinary course, there was no harmful animal use, but in fourth year there was the surgery course in which student groups would anesthetize, usually healthy young pigs, although sometimes sheep are also used, conduct highly invasive surgical procedures on them typically, and then these animals would be humanely killed under anesthesia if they had survived to that point, and end up in the cool room here awaiting disposal. I and one other student refused to participate in all of this mass killing and ended up implementing legal action and mass media exposure of harmful curricular animal use within our veterinary course, which was ultimately successful and forced the university to bring in humane teaching methods on a large scale and policies allowing students to conscientiously object to harmful animal use that were then picked up and adopted by other veterinary schools within Australia, New Zealand, and the US. However, for the sake of time, sadly, I don't have time to talk about any of that, which was very interesting. I'm going to move straight on to reviewing the types of humane teaching methods that exist for these sorts of laboratory classes. These sorts of laboratory classes are pretty standard across many health and life sciences courses around the world, and accordingly, a standard set of alternatives have been developed for them and implemented into many of these courses. They are things like high quality videos and computer simulations of dissections and animal experiments, cadavers obtained from bodies of animals that have died naturally or in accidents, or been euthanized for genuine medical reasons or severe and intractable behavioral reasons, and then donated for teaching purposes. They are not cadavers of animals such as animals from the greyhound racing industry or experimental animals that have not been killed for reasons of genuine euthanasia and ethically sourced. Body parts, ideally from ethically sourced cadavers, can then be preserved in a variety of ways and used repeatedly thereafter. Students can conduct non-invasive self-experimentation upon oneself or one's fellow classmates in order to demonstrate things like physiological principles, as is done in some medical courses. There are a variety of clinical and surgical skills, models, mannequins, and simulators. And of course, most importantly, there are supervised clinical and surgical experiences, whether they're called externships or not. Some examples of all of these now. There are many standard simulations of animal dissections that have been developed by companies around the world, catering to these sorts of common experiments that occur across the life and health sciences. Sometimes they include, or typically they include, photographs of prosections, that's professionally performed dissections. And if any of you have participated in these animal dissections in your training, and I'm sure most of you will have done so, then you'll probably be familiar with our experience, which was that when we were trying to dissect and display things like fragile abdominal organs of the rat that you can see there, these would typically be buried under fat, and as novice dissectors, we would tend to cut up and mash these fragile organs to the point at which they were not easily identifiable in many cases and make a mess of the whole dissection. The advantage of a photograph of a prosection is that the organs are clearly delineated, well exposed, and have not been destroyed, and they can be visualized. These dissections can often include slides of the microscopic or histological anatomy of the macroscopic or gross anatomy side by side so that students can see the differences in things like the cells lining the skin and the gut, as in this case. These dissections can be made available via intranet or the internet, such as this example from Colorado State University School of Veterinary Medicine, which was freely available online, but last I checked was available for a modest fee. You can dissect different parts of a dog, such as the head here, click on various structures, such as the masseter muscle, and get basic anatomical information, such as the point of origin and insertion of the muscle, its action, and the major nerve supply to the muscle. You can zoom in for a closer look. You can drag a slider across the screen and rotate the head to look at it from different angles. You can look at things like the radiographic anatomy, the clinical anatomy, and so on. Dissections like this have also been developed, or simulations, I should say, for human medical students of human body parts too. This is the face developed by a medical illustrator in conjunction with an anatomist for students at the University of Ohio Medical School. Students are able to drag a slider button across the screen and melt the tissue layers away from the most superficial all the way down to the bone. And by dragging the layers back in the opposite direction, they can all reappear, and they can do this as many times as they want, which of course is not something that's available with an actual dissection. You can do it once and then it's not can't be repaired. Students can zoom in and click upon specific muscles, such as the red muscle next to the nose there, and see what the muscle would actually do. In this case, it would cause the nose to twitch. You can also make the eye blink, the eyelid blink. And of course, these display functionality in these simulations that are not available with an actual head lying before you on a dissecting table. If you think that your head is starting to blink, that you obviously are not getting enough sleep in your medical course, or possibly your veterinary course as well. And there are many dissections available also for high school students and life and health sciences students at the university. This is Digital Frog 2. has different parts to the dissection simulation. Students can drag virtual dissecting tools across the appropriate portion of a frog. They're guided to do that. If they do that correctly, they'll see a video play of the actual professionally performed dissection of a frog. They can click upon the image in the bottom left, and if they do that, then they will see effectively arterial and venous blood flow through the appropriate chambers of the heart. And they can even click upon the speaker icon in the bottom right and hear what the frog sounds like, and learn something about the natural history of the frog in the wild. So these all offer functionality examples that are not available of a traditional animal dissection. Of course, there are ethically sourced cadavers too, as I mentioned, and these can be preserved using a variety of ways. That's a younger version of me in our anatomy museum back in our veterinary school, with sections of a horse's head. These sorts of potted specimens are typically preserved using formaldehyde or other powerful chemical preservatives designed to prevent dissolution of the tissues, bacterial putrefaction, and with other preservatives such as those designed to preserve color. It's possible also to get organs such as the cow's kidney here and perfuse the arteries and the veins with colored dyes, and then to dissolve away the surrounding tissues with mild acids over a period of several months. And it's also possible to plastinate specimens such as the squid in the lower right, which uses a vacuum and several chemical steps to replace all the fats and the water within the specimen by polymers, giving it a plasticky feel and removing most but not quite all of the odor from the specimen. So these sorts of methods enable these body parts to be permanently preserved. And as I said, ideally, they should be sourced from ethically sourced cadavers. This is an example of showing the vascular network of the liver and the gallbladder of a dog from Tufts University. And here's another one showing the lungs and airways of a dog. These were sourced from ethically sourced cadavers, and indeed the body donation program at Tufts University has been supplying all of their anatomy needs, all of their clinical skills training needs, and all of their humane surgical training program needs for many years. This is Gunther von Hagen. He's the anatomist who who developed the plastination technique, demonstrating that even the largest of animals can be successfully plastinated. Last I checked, he had 4 traveling exhibitions of plastinated animals traveling the world, and even one of plastinated human beings. And if you haven't had the chance to see one of these, I do highly recommend them. It's fascinating seeing the internal structures of animals so well preserved. And there is always, or commonly, an information plaque next to each display specimen explaining what the various muscles do, which is really interesting. I was gratified to see the information at the front of his exhibition in London some years ago, stating that none of the animals in the display had been killed for the purposes of the exhibition. They'd all been effectively ethically sourced. These ethically sourced cadavers can also be used for clinical skills training. This is Dr. Briony Dixon. She followed me and became the first veterinary student to graduate without harming animals in surgical training at the University of Queensland Veterinary School in 2011. She's practicing placing a chest drain into the cadaver of a dog that has been ethically sourced, so euthanized for genuine medical reasons, or died naturally or in accidents. There are also many simulations of animal experiments, many computer simulations, and the early simulations were rightly criticized for being unrealistically simplistic. But modern simulations include high quality videos of animals responding to actual drugs or other experimental interventions, They can include virtual bench tops, such as the oscilloscopes, which has been set up in the bottom. In my physiology class, we had to dissect out the sciatic nerve and hind limb muscles of a cane toad, place them across electrodes, apply various currents to the nerves, and watch and record the response in the muscles. So you can do the same experiment here virtually and set up the virtual benchtop, the virtual equipment, and apply these action potentials and observe the responses. There are many models that have been developed as well, sometimes for high school students, sometimes for people like laboratory technicians, such as this model that enables them to learn how to take blood from the tail vein of a rat, which is the main place to take blood from in a rat. For veterinary students, there are clinical skills moderns, mannequins, and simulators, such as critical care Jerry here. Students can practice procedures such as mouth to snout resuscitation, the placement of an ET tube down the trachea, blood sampling, and listening for normal and abnormal heart sounds and breath sounds, and attempting to identify the abnormal ones from a range of options applied by the instructor. This is Brownie Dixon when she was a veterinary student practicing CPR on one of these dog mannequins. The way that this was traditionally taught in many veterinary schools was that animals were given cardiac arrests and then students would attempt to resuscitate them. That, for example, was the process at the University of Sydney when I enrolled as a veterinary student. Here she is again. This time she has gone to the Royal Veterinary College in London, one of the world's leading veterinary colleges. And she's trying her hand at pregnancy diagnosis using a haptic simulator. Haptic technology applies pressure to the fingertips of a person, which is anatomically appropriate depending upon where they are inside a simulation. So she actually has her fingertips inside thimbles, which are connected to a robotic arm, connected to a computer, which is running simulation. And it can be programmed to be late stage pregnant, early stage pregnant, non-pregnant, or have pathological conditions. And she has to try to identify which of those she is filling inside the simulation. This was developed by Professor Sarah Bailey, one of the professors at the Royal Veterinary College, who also developed an equine colic simulator and a feline abdominal palpation simulator as well. Here's an example of an alternative, well, no, not quite yet. Ideally, an alternative veterinary surgical training program should comprise these three stages. Initially, students should practice their basic manual skills and hand-eye coordination, instrument handling, and so on, using knot time boards, plastic organs, and similar models. After doing that, they should simulate surgical procedures on ethically sourced cadavers. And then finally, they should actually observe, assist with under close one-to-one supervision, and then perform beneficial surgery on real patients. Similar to the way that human surgeons are trained. And a very popular example of these is animal shelter neutering programs, where animals are sourced from shelters, sterilized, and then returned for adoption. These are particularly popular because they help to address the fundamental pet overpopulation problems that shelters have to deal with. They provide experience at some of the most common and important procedures new graduate veterinarians will need to be able to do after graduation, and they help the veterinary school provide a worthwhile community service. So all parties gain from them, so they're very popular. This is an example of a surgical simulator, the dog abdominal surrogate for instructional exercises, or the DAISY, which is basically just a foam cylinder with multiple layers and coloured red threads running through to simulate blood vessels. And in the middle are foam intestines. I recall purchasing one of these for use. It took me a considerable period of time to practice initially scrubbing, gloving, gowning, preparing myself, draping the daisy, preparing my surgical instruments, blunt dissecting through my various tissue layers, finding, ligating the coloured red threads running through, exteriorizing the intestines, wetting them down the saline, removing a part of supposedly damaged intestine, suturing the ends together, pressure testing it, putting it back into the abdomen, closing up the various layers and so on. It was a fantastic simulation, and it's certainly students should always be doing something like this prior to then practicing the procedure on cadavers or living animals. There's no excuse not to be doing this. This cost about 15 US dollars at the time I bought it, and it could be rotated and used up to 6 times. There are more advanced surgical simulators as well, developed for medical students and veterinary students. And here's an example of a surgical program that we developed in the real world, as it were. So when we got to the fourth year of our veterinary surgical degree, our 5-year degree, we entered the surgical program. And as I said, one other student and I refused to participate in the terminal surgery laboratories that were the norm until we came through. And we were told that because we had gone to the university's governing council and successfully campaigned to have them allow student conscientious objection at the university. Therefore, we were allowed to conscientiously object to the terminal surgery laboratories. But because the surgery staff were not on board with the idea of humane teaching methods, they refused to teach us. So we would need to arrange our own surgical training. And if we couldn't successfully do that and then pass effectively a surgical examination to the veterinary school standards, they would fail us. So effectively, the people that were being paid to teach us were allowed to decline that role and keep their jobs somehow. And we were the ones that would be threatened with expulsion if we couldn't meet the standard. And we said in response to this, fantastic, because this was a major step forward for the veterinary school. Getting them to allow alternatives had been like trying to get water out of a stone up until that point. And indeed, that still was the case. So we said, fantastic, yes, we will agree to this. So we arranged to obtain our own external experience, assisting with beneficial surgeries on real patients and gaining other clinical experiences in private veterinary clinics and animal shelters. We also arranged to source some of these animal shelter patients and bring them to the university to conduct neutering operations on them under the supervision of the surgical faculty. As I said, if we weren't able to do that to their standards, their high standards, they would fail us. And on top of doing that, we still had to attend all of the terminal surgery laboratories as observers so that we could supposedly learn from the clinical discussions that would take place. This actually proved very useful because it enabled us to compare the two methods of training. I also bought one of these Daisy abdominal simulators, the foam cylinders that I have just discussed, and we also arranged to conduct some ethically sourced surgery, 7 surgeries on greyhounds and sheep that were being killed for genuine medical reasons. And we conducted a series of abdominal and thoracic surgeries on these animals. The results was that we missed out in participating in 13 scheduled terminal surgeries in the surgery course. These were conducted by student groups of 3. One would be the surgeon, one would be the assistant surgeon, one would be the anaesthetist, and they would rotate. So effectively, each student had around about 4 or so surgeries as the surgeon. We missed out on those, but instead we performed or assisted with at least 62 additional surgeries, not including the abdominal surgeries I performed on the DAISY surgical simulator. These surgeries were performed under supervision, mostly in private practice. So we did an awful lot of spay operations, 21 spays, and in total 45 sterilization operations on dogs or cats. In comparison, our classmates gained typically one spay if they were lucky, maybe half a spay before they graduated. And I was struck by the difference when observing one of these laboratories. I actually saw my colleague's hands shaking as she was trying to conduct a cat castration. We had 45 sterilisation operations under our belt before we even entered the final year of our veterinary degree. So the common problems with um, confidence and competence were not present in our case because we had so much more experience. We participated in a wide range of other common procedures as well that you would see in normal first opinion veterinary practice. We also gained experience with the preoperative assessment, anesthesia, maintenance of anesthesia, the postoperative care and management of all these cases. So we were much more experienced and had a much better start to our life in veterinary practice compared to our classmates. The surgical sterilisation program in animal shelters that we established did so well that it was then mainstreamed into the curriculum thereafter because all the other students wanted to get access to it as well because we were getting much more surgical experience than they were by refusing to participate in terminal surgical laboratories. Um, I then graduated and went into small animal veterinary practice, mostly around the United Kingdom for nearly a decade after graduating, where I was very successful, probably because I participated in the alternative program to some degree. And then an unexpected thing happened. I was recruited in 2013 to go here to Ross University on the small Caribbean island of St. Kitts under the shoulder of a volcano rising up on the right-hand side that you can see there. Um, when I arrived, I was placed into temporary accommodation. This was the view from my front lawn. I had to deal with traffic going back and forth past my windows, unexpected visitors, and this was the main campus of Ross University in the Caribbean. This is one of the cafes where the students and staff would eat their lunch overlooking the Caribbean Sea, and if they were very lucky, seeing sea turtles surface. Um, but the students would sometimes complain home that they weren't able to get a suntan because they were spending all their time in the library or here in the clinical skills training lab. I was the director of the clinical skills training lab, and I was recruited because I knew an awful lot about models, mannequins, and simulators in veterinary education because I had been a conscientious objector. Um, and our classes were so large that we had to repeat them 6 times for every laboratory in this former cafeteria that had been converted into a clinical skills training lab. And we started teaching things like instrument handling and suturing and progressing through the use of a variety of models, mannequins, and simulators. We would start in semester one and build stepwise the student skills all the way through until their full surgical course at the end of our at the end of the um, on island part of the degree before they would typically go off island to complete their final clinical year at affiliated veterinary schools across North America and internationally. How effective are all these sorts of alternative methods? I should say that, by the way, that our students seem to be particularly well regarded when they came to their final clinical placements. And I think it was because we had been using models, mannequins, and simulators from semester one and building upon those every semester throughout their degrees, which was not the norm in other veterinary courses. How effective are these sorts of methods? A few years ago, a colleague and I conducted a systematic review to look at educational studies that had assessed the acquisition of surgical skills, clinical skills, or knowledge by life and health sciences students, using either humane teaching methods or traditional harmful animal use. And we found 50 studies that had been published going back as far as 1968. Uh, and you can see studies showing that the alternative methods were superior. The ones in blue produced equivalent learning outcomes in orange or inferior outcomes in red. They had explored virtually all disciplines in which animals were used in life and health sciences training, and virtually all humane teaching methods that had been developed, computer simulations, models, and so on. Overall, the humane teaching methods produced learning outcomes that were superior, about 1/3 of the time, equivalent, nearly 2/3 of the times, and inferior, 10% of the time, to those produced by traditional harmful animal use. So alternatives don't always produce equivalent or superior outcomes, but they do if they are well designed. The ones in which inferior outcomes occurred were those in which the alternatives were not well designed. Part of the reason for this, there are multiple reasons, such as the ability to repeat procedures, which is often not available using traditional actual animals or their bodies. Another reason is that traditional harmful animal use is often very stressful for students. This was well demonstrated in this survey of 370 University of Illinois veterinary students about how they felt about the value of the first year physiology demonstration laboratories in which they were required to conduct experiments on more than 100 dogs, pigs, rats, and rabbits. And you can see the quotes here. It was difficult to get any great understanding of physiology because we were worried most of the time about not having our dog bleed to death or die of anesthetic overdose. Most of us too preoccupied with having to kill a dog that physiology wasn't concentrated on. Nothing was covered in the labs that could have been learned from a demo or a video. The guilt I felt for participating outweighed all beneficial aspects of the experience. Stress of the whole ordeal was worth nothing in the end. During one lab, my group accidentally killed our dog with anesthesia overdose because of lack of experience and the impatient, ill-given advice of a professor. This overshadowed any benefit gained by the lab. This sort of experience is common in these highly invasive demonstration laboratories around the world. It was certainly true in those occurring in my veterinary course as well, where typically we would have quite substantial class sizes and only 2 or 3 demonstrators wandering around the room attempting to supervise students who were doing this for the first time, studying notes from their lab guides that were not particularly well explained or clear. And there just wasn't enough man or woman power to supervise the students to ensure that the animals were kept safe. And so there were premature deaths and huge stress for the students who were trying to anesthetize and keep patients alive for the first time in their careers. Overall, about 59% believe these animal labs were not worth the resources used, and only 20% felt they gained great benefit in understanding physiology from the labs. Attempts have been made for more than a decade to introduce humane teaching methods at this veterinary school. I advised my colleague who conducted this survey, we were both students at the time, to simply go to the mass media as I had done. She did this. This was a major story. The veterinary school was flooded with complaints, and within 10 days, these laboratories were then permanently stopped. There's also a hidden curriculum endorsing harmful animal use associated with all this sort of harmful animal use. If you think about it, we have dissection, often of purpose-killed animals, or those from ethically debatable sources within anatomy. We have demonstration experiments on living animals, highly invasive, commonly animals killed during or after the experiment in physiology, biochemistry, and pharmacology courses. And then we've got terminal surgical and anesthetic labs in which animals are then killed at the end of the procedures. This has significant impacts on the attitudes of veterinary students. The majority of veterinary students receive little formal education in animal welfare issues or in critical reasoning and are being directly required to harm and kill animals during their education. This is providing these sorts of unspoken messages that harming and killing animals is not only condoned but required to become a vet, and that animal welfare concerns are subservient to human interests of debatable merit. This creates negative underlying messages about the intrinsic values of animals' lives. It results in severe stress in some of these laboratory classes, and this is well known to impair cognitive processes such as reasoning, recall, and so on, which are important for learning. It can also result in loss of interest in the sciences and some students even leaving. For those students that stay, there is desensitization to suffering and killing, and this appears to result in diminished capacity for compassion and ethical decision making. This has actually been documented in multiple studies of veterinary students, specifically the decreasing awareness of senior veterinary students of animal sentience, hunger, pain, fear, and boredom of a variety of species, decreased likelihood of senior veterinary students to provide appropriate perioperative analgesia compared to junior veterinary students, an inhibition of something called moral reasoning ability that all other students seem to develop over the course of a 4-year degree, but not veterinary students. Something holds them back. So these are all phenomena that have been documented. I think that these are actually psychological adaptations, that they enable previously caring students to withstand psychological stresses resulting from requirements to harm and kill sentient animals in the absence of overwhelming necessity. What's going on is actually cognitive dissonance. Students come in initially believing animals are sentient, can feel pain, and they care about animals. Then required to engage in behaviors that seriously harm and kill these animals. This creates dissonance. And the ways that we resolve dissonance is to either change our behavior or change our beliefs. Changing behavior would mean students no longer participating in these procedures. This is very high stakes for most veterinary students. They risk being failed out of veterinary courses if they refuse to participate in these procedures, and alternatives are not yet allowed, or to deal with less blatant messages that participation is expected or necessary if you want to be a good surgeon. Students who are failed out of veterinary courses are typically left with very large debts and not a professional degree enabling them to pay them off. So the pressure to continue to participate in these sorts of classes can be overwhelming. The other option then is to change one's beliefs, to no longer believe that actually these animals really are quite that sentient, really do suffer quite that much, really need to be cared about or provided with appropriate perioperative analgesia. So these are the effects that have been documented in veterinary students, and I think these are the reasons why these occur. Accordingly, as well as directly saving substantial numbers of animal lives within veterinary curricula, the use of humane teaching methods are actually more likely to result in veterinary graduates that haven't undergone these desensitization processes, have better animal welfare standards, potentially benefiting their future patients, more likely to see animals as sentient, give appropriate perioperative analgesia, and so on. There have been surveys by myself and others more recently showing that actually the positions of veterinary associations on animal welfare issues often falls behind those of the general public. And again, I think that this desensitization process is the reason why this has occurred. So, the use of humane teaching methods is also more likely to result in veterinarians that are more likely to become leaders rather than followers, as has been documented, of evolving social standards on animal welfare, as quite rightly expected by society at large. So, to conclude, well-designed humane teaching methods usually perform at least as well as methods that rely upon harmful animal use. Around about 30% of cases so far, more than 50 studies now, they've achieved superior learning outcomes. When they don't achieve equivalent or superior outcomes, it's rare, and it's because those alternatives have not been well designed. It's obvious that educators can best serve their students and animals, minimize financial and time burdens. I didn't have time to go into that today, but those are significant when associated with traditional harmful animal use through the use of well-designed humane teaching methodologies. Further information about humane teaching methods, as well as advice for universities, students, alternatives libraries, free online computer simulations, and so on, can be found on these sorts of websites. My own website, humanelearning.info, which particularly has guidance for students on how to tackle this issue, and of the International Network of Individuals and Campaigns for Humane Education, which is INTERNISH. I'd like to draw your attention before I finish to this particularly important study, which has recently been published in the Journal of Veterinary Medical Education by our very own Robin Chadman, a diplomat of ACOR, and her colleagues. They surveyed, well, they basically obtained or requested, I should say, ICOOC protocols from public veterinary schools across North America, mostly in 2023. And 26 veterinary schools provided 120 of these ICOOC protocols. There are protocols requesting the use of animals within teaching and is providing justifications and so on. Horses were most commonly requested, followed by cows and small ruminants, although poultry were requested in the highest numbers. There were donation programs, ethically sourced cadaver donation programs for cadavers or for animals requested for use in terminal exercises as a potential source of horses at 19 schools. I'm going to repeat a number of the quotes that have recently come out in this article because I think they're particularly pertinent to this topic. They said that animal alternatives and non-terminal methods have shown to be effective for teaching students the skills they need to achieve day one competencies, such as castration, spay operations, and dental care. Practicing skills repeatedly, either on models and simulators or repeatedly performing surgeries and procedures such as spay operations on multiple shelter animals, improves confidence and skills more than performing a single terminal procedure. So, terminal surgical programs tend to include a single different procedure on multiple different laboratories. Each lab you do a different single procedure and then you move on next week and do something else. Studies have shown that your surgical skills at the end of such a program are worse than if you conduct multiple spay operations on animal shelter animals. Additionally, student stress levels associated with performing procedures on live animals are reduced. We know that stress and anxiety inhibit learning. They interfere with cognitive processes such as reasoning and recall. The pedagogical method used is at the discretion of the training institution, i.e. the vet school. There are no requirements for students to learn procedures on animals, and I'm particularly worried about invasive or harmful animal use, particularly animals that will then be euthanized, they've said. I'm going to contest the usage of the term euthanasia in this paper. Euthanasia, by definition, is not only humane killing, which is what's going on here, but also killing which is genuinely in the best interest of the animals concerned, which is not normally the case when animals are not suffering from a severe and intractable condition and have plenty of years of potential good life in front of them. So I've said particularly those animals that then be euthanized, nor is there any similar veterinary licensing requirement. Some schools are teaching using terminal classes, whereas others use cadavers, live animals who are not euthanized, and non-animal alternatives. Nowhere in the guidelines or the American Association of Vet Medical Colleges handbook are terminal surgeries recommended. When they are performed, students are denied the opportunity to also participate in post-anesthesia recovery, pain monitoring, educating caretakers on care, managing complications, all of which are day one competencies. The guidelines recommend that schools critically evaluate all animal use to determine if it's necessary to achieve educational outcomes and proactively work toward reducing invasive procedures to those that have potential to benefit the health and welfare of the animal, and also recommend the use of non-animal alternatives. They noted that while some schools have implemented animal use practice in accordance with these guidelines, many have not. There remains the need for increased critical evaluation of animal use in veterinary school curricula and an improved understanding among instructors of the beneficial role of non-animal alternatives. If you'd like to look at any further resources in this area, I have some on my website, humanelearning.info, and the study that I just mentioned, that excellent study by Chadwin and colleagues, is again repeated for you there. Thank you very much, everybody. I'm now very happy to take any questions if anyone has any. Thank you for your attention.